You have often heard me say that many sexual problems, in fact, most sexual problems, are psychological in nature. Their causes are psychological. In today's video, we will specifically talk about those psychological sexual problems that occur particularly due to psychological reasons, especially in men. We will discuss these issues in men, and later in another video, we will definitely talk about psychological sexual problems in women as well. Assalamu alaikum. I am Dr. Tahira Rubab. Along with being a psychiatrist, I am also a sex therapist. As I just mentioned, many of these problems do not have actual physical causes. Rather, their causes are psychological. Among these, one major issue that is often seen in men is premature ejaculation. Premature ejaculation means that your timing has become very short, meaning you start to reach climax too quickly, sometimes within a few seconds, a minute or 2 minutes, and your duration does not go beyond that. This means that you ejaculate or discharge very quickly, which leads to frustration for both you and your partner. Sometimes premature ejaculation can happen just once or occasionally for this reason. Okay? So maybe you were under stress for a long time, or you were under work pressure, or you hadn't had sexual activity with your partner for a long period, meaning you were inactive. Or it could be that there was no particular reason, but you were just tired, your sleep wasn't good, you weren't sleeping well, or you were exhausted. Because of this, sometimes just once premature ejaculation or early discharge can happen, or your timing can decrease. Now, when your timing decreased that one time, your human brain conceived the idea somewhere that maybe you have this problem. Now, when this thought entered your mind that you have a problem, and whenever you meet your partner again, that fear is already sitting in your mind, you experience it, and it happens again that you have an early discharge. Because of this, your belief becomes even stronger that you are experiencing premature ejaculation, or that you have started having a timing issue, that your timing has decreased. As a result, you are always living in this fear whenever you meet your partner, and this fear is always present. Then your behavior, your attitude towards your partner also changes, and premature ejaculation starts happening regularly. In reality, there is often no medical reason for this premature ejaculation. Even in cases where there is a medical reason, psychological reasons, very significant psychological factors are also involved. So, this kind of premature ejaculation that is happening due to some kind of fear can be called psychological premature ejaculation. You can say that it is a psychological sexual issue which, if you handle it psychologically or develop a bit of confidence within yourself, can be managed. Because due to the constant lack of timing, people lose confidence. They feel that they cannot perform well at all during intercourse, or this fear becomes so overwhelming that their performance deteriorates even further. If you improve your thoughts regarding this issue, improve your mindset, or seek psychological help, then this problem of yours can be improved without any medication or other things. Just through psychological methods with some techniques and sex therapy, you can improve it. The second issue, which we also see very commonly, is that some people have oversensitivity. They get extremely excited, especially when they meet their partner after some time, or, for example, on the first wedding night when they meet their partner for the first time. In such situations, their body becomes highly excited, and when the body is overly excited, they are unable to handle it, which can lead them to experience premature ejaculation again and again. They start to feel that they have a timing issue, or their organ becomes overly sensitive. The sensitivity of the organ increases a lot. And if you are extremely excited, if there is a lot of excitement and enthusiasm, then that sensitivity increases even more, which can lead to problems like lack of control over timing. If you learn to effectively manage your overexcitement, then your sensitivity can also gradually decrease, and as a result, you can manage your timing as well. Then again, for this, you need to visit a qualified doctor or a sex therapist so that they can properly explain the techniques to you, which can help you solve these problems. ED, that is erectile dysfunction, is when there is a lack of firmness or the inability to achieve any firmness at all. This is also an issue in which generally people become victims of this problem psychologically. For example, as I mentioned earlier, it can happen that one time, for some reason, you didn't get a proper erection, you didn't achieve the necessary firmness. But because of that one time, it didn't happen, you latch onto it in your mind. Then a continuous cycle starts in your mind. What if it doesn't happen again? What if it doesn't happen this time? Normally, as we are discussing, we often hear that people experience a decrease in desire, and sometimes this lack of desire can be due to many biological factors. For example, it can happen due to diabetes, due to stress, or if someone has a heart problem, it can be because of that. But many times, people who experience a lack of desire often face it because they don't have a connection with their partner due to a lack of emotional connection, not having a good experience because of depression or because of anxiety. Yeah, people often face a decrease in desire due to these reasons, and when desire decreases, of course, dissatisfaction with the partner also increases accordingly. And when people don't feel like it, they find it very difficult to engage in intimate relations. When we have many psychological problems, meaning when we are dealing with issues due to psychological problems, many people who are involved in psychological problems, ultimately, those psychological problems affect their body functioning and even their intimate desires. Because of this, sometimes due to high levels of stress hormones in our body, or sometimes due to underlying depression, not only does desire decrease, but sex hormones also start to decrease. And when sex hormones start to decrease, it affects sexual performance as well. If any of you are facing any kind of sexual problem, it is possible that the reason behind it is primarily psychological. And if you have gone through any illness that has led to a sexual issue, then somewhere behind that, there is also a psychological reason involved. If you resolve your psychological issues or learn how to control your anxieties, you can succeed in solving many of your sexual problems. I hope today's video will help you understand your problems and assist you in addressing them. Don't be afraid or hesitant to visit a doctor, psychologist, or sex therapist. Instead, try to address your issue as soon as possible so you can overcome it quickly. Because most psychological and sexual problems can be resolved without medication. For this, you don't need medication, you only need psychological treatment or, in some cases, sex therapy. With the help of these, you can easily overcome your problem. Take good care of yourself. We'll meet again in a new video with a new topic. Until then, goodbye.